St. Andrews is a private, non-for-profit organization. We receive no funding from the government. The vast majority of the people who are participating and helping the clinic are volunteers.
I love it. I do it every month. I've done it for 2 years now. And we work in the distribution area, food distribution.
I love it. Driving the van back and forth between the church here or the clinic and the border.
It's part of like our theology grade, so we're giving back to the community, not just like learning from textbooks and stuff.
This is like part of my life because I've been doing it for so long, and I've made wonderful friends here.
My name is Rachel, and I'm a nurse, but also now I'm a first-year college medicine student. And I've been coming to the clinic for about 1.5 years, and I generally work in the nutrition area.
One of the things that really has impressed me is the fact that this has grown to be a grassroots effort. The clinic has developed and is maintained through the efforts of people on both sides of the border. You have people who come from different religious backgrounds, different political backgrounds, people who come from urban settings such as Tucson, people who come from more rural settings such as small towns in Mexico, and we all come together for one cause, and that is to help these children. We have an agreement through the College of Medicine CUP program, and that's Commitment to Underserved People, that they will have their students come down and interact with the patients.
We see a lot of children with diseases that we wouldn't see at this stage of progression in the States. We see some more rare things. I think a lot of the residents see things here that they wouldn't see in their normal training.
It was really neat to put some of the experiences that we've learned about in class, some of the information we learned about in class, to use.
I don't think I'm going to be the physician I want to be unless I start early, getting exposure to these kind of situations. As much as they can teach you in the books, it's a lot different in the real world for sure.
In one morning down here, we can teach them more than they learn in some 6-month rotation elsewhere.
The work that is carried out through St. Andrews is carried out by private donations. We do have private foundations who provide financial support, but the bulk comes from individuals who send in a couple of dollars or a little bit more. There are other people who help us by volunteering and helping us out in a multitude of ways. When people come and see St. Andrews, there isn't anybody who isn't moved. There are people who are brought to tears because of the good that they see being done.
It changed our lives, his as well as mine. It's different now with a prosthesis. He can have a normal life, just like any other child.
Normal como cualquier niño.
Y porque, digo, para ponerse a pensar, uno de poder realizar una vida, por ejemplo.
To think that if I hadn't had the surgery, I wouldn't have had the opportunity to fulfill my life and have a family.
Pensar de uno de querer formar una familia.
It's very good. It's very rewarding.
I liked it. Like, I wish I could come every month.
It's next to impossible to describe, except that it feels great.
There's a lot of unmet need, and I think that anytime you can help alleviate some of that need is really important.
There'll always be a need for the clinic. There will always, always, always be a need.
Señor, mueva sus corazones y
I want to ask everyone to look into your heart and extend your hands, especially those who are able to donate something, because there are so many people here who need your help.
Esta gente que necesitan de la ayuda de los demás.